in the interest of time, I'd like to move over to Dimitri Prybylski from US CDC. Dimitri, really welcome again. It's nice to see you. And you know, you come from with a wealth of experience in epidemiology, field epidemiology. So you know, I wonder, you know, when you apply lessons learned from the past outbreaks, like Ebola, Zika, etc., HIV, and also from COVID-19. What do you think does the future of social listening look like for public health? What do you recommend for public health teams to do to move into a proactive space in social listening and work?
Yeah, Tina, it's great to see you. It's great to be on this panel. You know, I think that we've learned a lot. I think if you even go back to Ebola, some of the offline lessons we learned, you know, about mass burials and the realization that you need behavioral scientists and anthropologists and health communicators to work together as a team with epidemiologists to address issues, to have safe burial practices that, for example, recognize you know, community traditions and beliefs. You know, there was incredibly powerful synergy there. And I work on a team with, as an epidemiologist, with behavioral scientists and health communication specialists, and I find it to be incredibly useful for sort of having this ability to look at things in a multifaceted way. I think, you know, what makes COVID-19 somewhat special, and because I've worked on HIV for a while, is what we're seeing in terms of social media and the digital age and how it can amplify, you know, messages and mis and disinformation around the world in a way that doesn't respect borders, and the need for kind of a very cohesive public health system and mainstreaming of infodemic management and social listening into that. And, you know, pick up on some of the earlier comments that Peter made at the very beginning, you know, I think these investments in the structures and systems are going to be really crucial. And how do we sort of leverage the existing more conventional approaches to public health infrastructure and systems and integrate infodemic management, social listening in that regard? You know, I think some of the other issues are like, how do we build that capacity? And so, you know, at CDC, we work on the field epidemiology training program, which is really to develop a cadre of field epidemiologists who are often working at the very local level to address, you know, epidemiologic issues. But in the same way, and I think there are also some previous presenters over the last few days who talked about the need for field infodemic management training. And I know a lot of the stuff that we've collaborated on together is about building this human capacity. But along with that has to come the recognition that where does this fit into the public health infrastructure? Like, will ministries of health start to integrate infodemic management as part of a core function as well? And what are some of the ways that data can be collected, managed, analyzed, disseminated using integrated platforms that are not just specific to social listening, but integrate across what we know about disease transmission, about different subpopulations and trends over time and patterns in you know, epidemiologic information, and what is that ability to triangulate and have that integrated analysis for that. So I think there's tremendous excitement. I was really happy to see how the international health regulations are now being addressed to, you know, inject infodemic management as a key aspect of that. I think in the same way, integrated disease surveillance and response will also address infodemic management. I think as Joan touched on, though, there are some differences as well. Like you know, when you're counting cases, for example, it's a pretty, you know, there are definitely respect for personal identifying information, but who gets to be the arbitrator of truth? You know, I think this is something that where there's the need for independent fact checker organizations and civil society to have a major role in, you know, you don't necessarily want a public health authority to be making those decisions. So how is there this broader civil society engagement in that regard, which will need to really be thought through in terms of like how infovalence as a public health system gets further mainstreamed. So those are just some observations where I see things going. I think the need for this investment, global investment in this is, really crucial. Jess Collis on my team presented the State of Vaccine Competence Report as an example of a nice, efficient kind of way of packaging information as evidence for action with sort of really public health next steps that can be addressed. And I think that that's a real step in the right direction. It's a routinized report, and I think the routinization of this field, moving away from kind of ad hoc data collection to more routine, systematic data collection and analysis will be really crucial, given just how dynamic issues around, for example, vaccine hesitancy might be, and what some of the reasons for it might be in different populations. So I'll stop there.
That's great. As someone having health information systems backgrounds and health analysis backgrounds, I really think I totally agree with you. Building systems is what will make this sustainable and really raise capacity further. Chris, before we move on, is there any burning questions or reflections from your side?
Appreciating the points you're making, Dimitri, about the value of integrating infodemiology and infodemic management into country preparedness and response plans. That's a really valuable point to underscore, and having that social listening, that infodemiology program as part of the routine epidemiological surveillance to help detect emerging and resurgent health threats more quickly, including the accompanying infodemics. Really appreciate that point as well, and really points to the importance of also integrating infodemiology systems across countries and regions as part of a global system, and trying to connect that those actionable insights that are coming out to an early warning system as well is something that came up in my mind when I heard you speaking. So thank you very much for making these points and getting our juices flowing about what next steps would look like for social listening. Over.
Thank you, Dimitri, very much. We'll get back to you for the last round of the rapid fire questions. Dimitri, what about you? What would be your recommendations going forward?
All right, so it's a great question. I think one thing in working with my colleagues in the more med-epi sort of area is understand that there is no magical pill for mistrust. I think a lot of times people in public health are looking for like biomedical solutions to public health problems. And in this case, trust is embedded in community engagement and trust. So I think like when I think about CDC's role, when I think about our global public health community, it's this connection to communities and strengthening those and moving beyond the kind of biomedical model in that regard, I think is going to be really crucial. I also second the need for this sort of policy framework that will be incredibly useful to, create the structure for, strategic investment of resources into things that we've discussed in terms of capacity, human capacity, in terms of the sort of systems and structures that need to exist. And I'm hoping that one silver lining of this pandemic is that there's a wokeness in the global community as to the fact that this is unfortunately not likely to be the last pandemic we deal with in our lifetime. So, and we're seeing what's happening with the variants and everything else, and that this is going to be an ongoing issue, and it's just not going to go away. And then the final thing I'll say is this importance of a community of practice and research. I think Peter and Patty, they mentioned the Africa Infodemic, Response Alliance, and these kind of country-to-country learning platforms are going to be really crucial as well to really make sure that what is being developed is country-led, is really self-determined to a large degree, and that the global community and regional community can best be supporting that and providing, guidance and help with distilling best practices. But this need for community and for in-country leadership will be really crucial. So I'll stop there. Thanks.
Great, thank you, Dimitri. You're also basically touching the points of building systems and capacities beyond on the health system. So I really appreciate that